Greetings. My name is Mabinti Karoma, the Market Dynamics Working Group Manager for FP2020. The group is led by John Skibiak of the Reproductive Health Supplies Coalition and Alan Stable of the Clinton Health Access Initiative. The group was the last group formed, and it was the last group to finalize its terms of reference, but it continues to accelerate progress and the first group to complete all Q1 deliverables. The working group is comprised of leading experts from UNFPA, USAID, key manufacturers, as well as generics and social marketing organizations. The Market Dynamics Working Group aims to answer three core questions. How do you minimize the gaps between supply and demand and improve global forecasting? What is the vision of a well-functioning market for family planning? And lastly, how do we align procurement practices and accelerate family planning product registration? Since launching in November with its first meeting, the group developed a three-pronged approach to answer the aforementioned questions. And through this work plan outlined here today, the activities here are just a part of achieving the following concrete outcomes: enabling women to choose from a broad range of quality-assured family planning methods, securing better value for money, and promoting equity to access of family planning. In this plan, as you can see in slide 2, we focus on 3 work streams. To answer the first question, how do we minimize gaps between supply and demand and improve global forecasting, we developed the Knowledge Management and Data Transparency work stream. Through this work stream, we're looking at scoping out and triangulating existing data sources to improve market intelligence. So it's not only looking at consumption data, but also looking at the supply side. To improve access to supply side data, the Market Dynamics Working Group members, led by CHI, reached out to manufacturers to improve market shaping by requesting historical shipment data. Together with our co-lead from CHI, as well as the Reproductive Health Supplies Coalition and FP2020, the team was able to reach out to a number of manufacturers who agreed to share their shipment data. In addition, to improve knowledge management and data transparency, the group looked at service delivery costs as well as household out-of-pocket expenditures. And it's also working to map out system strengthening policies. Secondly, to answer the question, what is a vision of a well-functioning market? The group looked at health-related markets such as HIV/AIDS, TB, and malaria to inform the development of a well-functioning family planning market for family planning commodities. The group coordinated with Prashant Yadav of the University of Michigan and his team to inform some of the deliverables in answering the question, what is a vision of a well-functioning market for family planning commodities? And lastly, to answer the question, how do we align procurement practices and accelerate FP product registration, the group worked with generic manufacturers, specifically through the Concept Foundation, a member of our working group, to share a registration database of generic manufacturers. And also to look at existing procurement practices and look at ways to streamline these practices as well as optimize registration of a broad range of quality-assured family planning commodities. We've been able to achieve success in a short period of time. The Market Dynamics Working Group, in improving global forecasting, was successful in securing 4 MOUs signed by manufacturers. The MOUs are signed with CHI and will be coordinated and managed with the Reproductive Health Supply Coalition. The FP2020 team reached out to additional manufacturers to share historical shipment data. We also looked at the global out-of-pocket expenditures to improve global forecasting and completed initial assessment looking at low and middle income countries and some of the challenges in securing this type of data. We also worked on developing a vision of a well-functioning market. In Q1, we were successful in completing an initial round of research in addition to developing a top-line assessment. We are working to have further discussions, including one that we had last week, looking at what are the key principles of a well-functioning market in addition to developing a framework. Lastly, the Concept Foundation, a member of our working group, will be sharing a detailed registration database of generic manufacturers, and this is designed to help inform what commodities are registered and how do we accelerate the registration of quality assured commodities. In response to market dynamics, we've been receiving a number of questions about the role of the market dynamic working groups. What is the status and what is the strategy around the distribution of long-acting reversible contraceptives, as well as questions about how manufacturers can support FP2020. In the coming weeks, we plan to answer a number of these questions and more and continue to move forward with progress. Not only is the Market Dynamics Working Group working to improve data transparency, but also to improve transparency with our stakeholders, communicating our progress, highlighting the areas of work that we've been able to deliver on, and will continue to accelerate progress in Q2 through Q4. Thank you.